Thank you again for everyone being here on this day. This is a Care Answered webinar, a digital twist on advanced care planning. So I'm very excited, as I always am, to present these webinars and have fabulous guest speakers. My name is Nicole Christensen. I'm a patient advocate, a board certified patient advocate, and the founder and president of Care Answered, where we navigate people through the healthcare system to access their best care while giving their loved ones peace of mind. I am also the author of the book, From Crisis to Calm. So, one of the big things that I talk about is healthcare proxies and advanced planning. And now we have a way to digitize it. So I'm going to be talking about that. And my guest speaker, Wendy Weiss from Tech Time, is going to be talking about other things that we can digitize and make our lives easier for not only ourselves, but for our loved ones. So let's get started. Advanced care planning with ease digitally. So this is what we're going to be talking about. And I'm going to start with what some of us already know about providing a healthcare proxy and having that understanding. So taking control of your care. We talk about advanced directives a lot. And so I put these different definitions for everybody to read and understand. So advanced directives is often a written statement of a person's wishes regarding medical treatment, often included in a living will. It's to make sure that those wishes are carried out should the person be unable to communicate them to a doctor or to any healthcare institution. A healthcare proxy is a document. I often refer to it as a person, right? But it's actually a document that names someone you trust as your proxy or agent to express your wishes and make healthcare decisions for you if you're unable to speak for yourself. They can be called healthcare surrogate, a durable medical power of attorney, healthcare agent, different terms for different states, but they all really mean the same thing. And there's also different forms in each state. A MOLST is a medically ordered life-sustaining treatment. That's also a form. The name of it, as implied, is it's medically ordered. So this is something that your doctor, a clinician, signs off on, that you've articulated your wishes, end of life wishes, or if you're incapacitated, those wishes are made known and made available wherever you are. You don't have to be in a hospital or a rehab. You can take it home. You can take it to a place you're visiting in the country. They will follow through with those wishes. The other thing is a power of attorney. Now, I am not a lawyer, but I can suggest really good ones that you can work with. A power of attorney is for making decisions for you, financial decisions, when you are incapacitated, generally speaking, right? You can have a power of attorney for different things, but this is what I am talking about in this context. So the reality is that healthcare costs money. So it's really important to have both of these in place. And many times they're not, you may choose for either your healthcare proxy and power of attorney not to be the same person. So it's really important to talk about that and have that as part of your team. Okay. Now, benefits of a healthcare proxy, hopefully everybody can see this, but the reality is 92% of adults believe it's critical to have their medical preferences assessed so that people know them, right? So most of us believe that that's an important thing. Patients with healthcare proxies have fewer hospitalizations and are less likely to die in the hospital if that's their preference, to not die in a hospital. Those with healthcare proxies are more likely to get care aligned with their preferences. And families experience better quality of life in general when people have a life healthcare proxy, and then less stress after a loved one has passed. Because they know that I would assume, because they know that their wishes have been followed. And there's ease and peace of mind in that. So the other fact is only 32% of healthy adults have a healthcare proxy. Only 38% of adults with chronic illnesses have one. So in my thing there, what? You know, so many of us understand the need for it, but so few of us actually do it. And in reality, that's less than the number of people who have wills, which I'm not discounting wills. Wills are very important to have, but this is when you're living. And it doesn't mean that you're necessarily incapacitated forever. It may not be an end of life issue. So we need to have these in place for all the circumstances in which we could be incapacitated. So now that we know only about 30% of us have one, more than 1 in 3 proxies is incorrect or unsure about their patient's actual code status. That means basically, they're unsure about what they would want if their heart stopped or they stopped breathing. And then more than 1 in 4 proxies reported that a preferred code status that did not match the orders in the electronic medical record. That means what they took the time or spoke with a clinician and may have said one thing, but their healthcare proxy said something different. So what does this mean? That means the few of us that have healthcare proxies, those that do have them don't really know the wishes or have understood or have had those conversations. So I'm going to do a quick poll. If you could fill this out really quickly, it's just yes or no, or I don't know. Hopefully you can see that. All right, I think that's all of us. So we have majority, 75% of us have a healthcare proxy. So kudos to you. And those that don't, obviously, you're not in bad company, right? You're actually a majority, even though you're a minority here. So I hope that just gives us an understanding, right? That how many people don't have them. And again, kudos to you that do. Okay, so let's take control of our care. Selecting a healthcare proxy. This is very important when we talked about those numbers that we mentioned before, about those that don't have it or those healthcare proxies that really may not understand what the person wanted. So first you think about who are the people close to you, okay? And so just making a list of those people that are very close to you is a kind of a starting point, right? Not all of them are going to be appropriate to be your healthcare proxy. Because one of the things is that you need to feel comfortable sharing your medical information with them. Why is this? Because they're also the person that, say you have an elective surgery and you're going to be under general anesthesia. They are going to be the ones that say, oh, you know what, Nicole is allergic to A, B, and C, or they had a bad reaction to a certain anesthesia. So they need to know this information. They need to know your diagnoses. They need to know your medications. They need to know your basic medical history so that they can be an informed healthcare proxy. And the other thing that you might want to think about is that if your healthcare proxy could have access to your patient portals. if you're comfortable with that. Again, we don't know when things can happen, but if they have that information, that might be helpful. Again, this is somebody that's close to you that you feel comfortable sharing that information. They don't have to be on there every second of the day, obviously, but just so that they have a good understanding so they can best help you and speak on your behalf. And who can carry out your wishes if you're incapacitated. So you might have a person that is close to you that you feel comfortable with, but you know that whatever your wishes are, they're just not going to be able to do it, or they're not going to be able to speak out for you. That's not the person then. You need to have all of those criteria. And with our Care Control Partners program, we can do that. We help you select your healthcare proxy. We help you go through the questions and then have it less daunting. And then we can share that information with your healthcare proxy. So here are some tricky questions that people get concerned about. But they're not really tricky. It's really about the ongoing conversation. None of this is set in stone. You can change your mind. Okay, so if you have your healthcare proxy done when you are 18 and now you're 35 and then you're 65 and then God willing you're 95, it's probably going to be different things. So we have to understand as we grow and keep our healthcare proxy informed. So how long, the artificial feeding tube, that can be a tricky one. I know for myself, I'll speak about, for my father, we're known as being really good eaters in my family. And we enjoy food. And so the idea of not giving him sustenance was very, very hard for us. And it wasn't a conversation that we had because we just didn't think about that. But it's something to think about. And it might be different for different people. They may say, yes, I'll do artificial feeding or a feeding tube if it's to get me through a period of time, but maybe not if that's the only thing that's elongating my life, or some other question. So these are the things that one needs to think about. And again, the things that we walk you through. And then hospital or home. Some people will say, I do not want to go to hospital at all. I want to be at home. Some people will say, I'll go in the emergency room, but I do not want to stay in a hospital or a nursing home for any long period of time. I would prefer to have my care at home if possible. And then artificial breathing and ventilator. Again, because of COVID, we've had these conversations a lot. Oh, what are we utilizing it for? Maybe it would be a difference if it's, again, a short period of time versus the rest of your life. These are questions. And again, it's ongoing conversation and we update as necessary. But these conversations are as important as the document. Okay, so who needs to know your care plan? Let's do another poll if you don't mind. Here we go. What do you think? Who should know? The choices are lawyer, doctor, family members, loved one, orthodontist. Pick as many as you want. Hopefully you have it there. Okay, so I'll go with what we have now. And so what we have is 86% of you said lawyer, 100% of those that answered said doctor, 100% said family members, loved ones, and 14% said orthodontist. I threw an orthodontist because I feel like I'm there all the time with my son. But orthodontist may not be somebody that you need unless you're having a dental surgery that you think that they should know. But yes, it's basically all of the above except maybe the orthodontist. That they should know that you have a healthcare proxy, that you and who that person is, and some information certainly about what your wishes are, especially obviously your healthcare proxy and your doctor as well, and your lawyer if they're working, because we work with lawyers as well, and they may have made what I addressed before as a living will. So if there are changes, we through the care control partners can address them and make it known to your lawyer as well. So everything's on the same page. Also, what that does is bring legal and medical together, which oftentimes they're siloed. So this brings it together so that everybody knows your wishes. So thanks for that. So right here it has it. Who needs to know your plan? It's healthcare proxy first and foremost, of course, your doctor. I put your power of attorney again because those two people, if they're two different people, are going to need to work together to really make your plan come to light. And again, your lawyer, if they're creating the living will, it is good that they have the documentation as well, if it ever needs to be looked at legally as well. Okay, who needs a healthcare proxy or a healthcare agent? Everyone 18 years and older. This is the truth. Again, we've heard some stories of young people going off to college in another state or far away in the same state. They're in an accident or they have an illness. Their mother, their father calls and the hospital says, well, we can't, there's no healthcare proxy in place. So you don't have the right to make those decisions. We don't want that to happen. So it's 18 years and older. Everybody should have a healthcare proxy. How do you get help? How do you get help to do this? So elder law attorneys, as I mentioned before, work with living wills, doctors. You can go to your doctor if you have Medicare and many other insurances, but Medicare in particular, if you're over 65, they get paid, they can code it and we can help them to code it so that they are actually being paid for these conversations about advanced care planning. So the other thing is the healthcare proxy, it's online. Different states have different forms, but you can definitely get them from our Department of Health in New York or whatever agency, but it definitely is online. The thing is that it doesn't give you a lot of help in coordinating it and to asking all those questions of yourselves. And again, through us at Care Answered with our Care Control Partner program, again, we digitally ask the information, hold your hand through it. And if your doctor approves, can put it in your portal. So it's in your medical records. If you want your lawyer to be updated, if you already have a living will, we can put them in there too. So this is the cool kind of thing. So the software that Care Answered is using, we've had the Care Control Partners before and it was on paper, but now we have it digitally and electronically shared. So, and it's all HIPAA compliant, of course. What we give you after the sessions and that it's completed, besides the healthcare proxy form that in New York, we go, and again, we can do it all over the country. So New York has, you have to have 2 witnesses. So you'd have to get that. But at the end, we give you this card and we'll laminate it and send it to you with a QR scan that if God forbid you're in a hospital, you have that, they can scan it and know what your healthcare wishes are as well as who your healthcare proxy is. And they can inform them. So that's us in digitizing healthcare proxy and advanced care planning. If you'd like to know more or you'd like to set up an appointment to see, to get that done, you can give us a call or email us. Are there any questions? I'm going to take a look in the chat. Nope, I think we're good. I'm going to stop my share. And now I am going to introduce my guest, Wendy Weiss, who is the owner of Tech Time. She has 20 plus years, right, of experience. And she is coming to make our digital lives easier, make our lives easier, one step at a time. So Wendy, can you tell us a little bit more and start your slide?
Okay. So Nicole, thank you so much for having me as your guest today. It's an honor to be here and work with you. We go back a couple of years, colleagues, friends. You're a lovely lady, I have to say, in so many ways.
Thank you so much, Wendy.
So again, my name is Wendy Weiss and my company is Tech Time. And what we do at Tech Time is we teach individuals, businesses, and conduct classes on the everyday use of your technological devices. So anywhere from your iPhone, your iPad, computers, Macs, applications, Office 365, Word, PowerPoint, Excel, Google Drive, the apps. And another project that I work on with many people is called Digitizing Your Data. So I'm just going to plow right into my presentation here. And basically, what is digitizing personal data? So it's to create, store, and share important information, quote unquote, data for your loved ones. So basically getting your affairs in order, it could be very difficult, but it's such an important part of preparing for your future, for you and your loved ones. It's important to gather as much information as possible to ease the process prior to really the unknown. So making your wishes known to your loved ones, creating important documents and putting them in an accessible place and making sure that your plans for your care is followed. So I'm going to walk you through the steps of digitizing this valuable information and basically to simplify this for yourself and your loved ones. So I'm assuming everybody can see my screen. I have an Excel spreadsheet displayed. And what I've done is I've created a spreadsheet and it's broken out in tabs. And so the first tab is personal information. So I've done this document for a gentleman by the name of Kevin Anderson. And basically I've taken a snapshot of his life. So I have his name, address, his cell phone number, his cell phone passcode, his email address. Some people have multiple email addresses, so that would be listed in this document. His social security code, his desktop computer password, his date of birth, his place of birth. In case of emergency, he gave me his wife, her email, her cell phone, the address. He also tells me that his social security card is in a safe deposit box over at Sterling Bank, along with a diamond ring and a Rolex watch. So the next of kin will have access to this document, and all this information will be outlined to them. So the next tab are all the important contacts in Kevin's life. So his will executor, his attorney, his accountant / financial advisor. He has a son and a daughter. And again, all their contact information, their name, company, phone number, email address, and living address. So basically you have the attorney who wrote the will. The next tab is basically all their insurance policies. So he has auto, homeowners, umbrella, long-term care, life insurance, Medicare, and supplemental insurance. And everything is laid out. So we see what insurance companies each policy is with, the policy number, how much his policy premium is, if it's on an annual basis, a semi-annual, quarterly, etc. The phone numbers for these companies, the agents' names, and the agency, any information giving about the policy. So for example, life insurance, 5-year policy, it increases 5% every year and it's worth $1 million. His beneficiary is this person. Next tab, all his investments. So he has an account over at Schwab. We laid out the website. This gentleman does everything online. So he has a user ID and a password for all these investment websites. He also has accounts over at Morgan Stanley, Vanguard. He has a pension from a union, all the user IDs and passwords. He has an IRA, joint account, and it states who the money will go to when he passes here. All the account numbers, his contacts over at Schwab, Vanguard, again, their phone number, their email address, and the beneficiaries on all those accounts. Here's a listing of all his bank accounts. So he has accounts over at Chase. He has checking accounts, a savings account. He has accounts over at Bethpage Credit Union, and he has a safe deposit box at Sterling National Bank. Again, here are all his user IDs, his passwords, the type of accounts, the account number, if it's a joint account, the phone number at the bank, the address of the bank, how much money he has in some of the accounts. He has a home equity line of credit of $300,000. And the safe deposit box has Kevin, Joan, and Steve on that. And he also states where the keys are to that safe deposit box. Next tab, a listing of all the credit cards. He has a Costco Visa, a Chase Visa, Capital One MasterCard, and an Amex card. And again, it's all listed out. The cards are under his name. It's a credit card. If it was a debit card, that would be listed. The credit card number, the phone number to get in touch with the credit card company. And then these are all the other websites that Kevin goes to. So he orders ink cartridges from HP. He has an Apple ID. He has a Zoom account. He goes to AARP. Again, so he logs into the NYU Langone Health Portal. And again, he has a car, he has a lease with Lexus. So everything here is documented. He subscribes to the New York Times, the Wall Street Journal. These are all his credentials. Miscellaneous. So Kevin and his wife own 2 properties. They have a house here in New York. They have a house down in Boynton Beach, Florida. These are their cemetery plots out in Wellwood. That's where him and his wife are to be laid to rest. They have a total of 8 plots and 5 are available. The papers to the cemetery plots are in the safe deposit box. And then lastly, how are your bills paid? So we all have monthly bills. So say you have a mortgage. How is that mortgage paid? Is it paid out of your checking account? You write a check. So everything is documented here. You have a car lease. How is that paid? Is it automatically deducted from your checking account, a savings account? Is a check written out? How are your real estate taxes paid? How are your cable bills paid? And again, everything is documented here. The amount, the due date, the account number, and how the amount is paid. So this is created in Excel and it's password protected. And I also back it up to a USB drive. We print this out and we make it part of your will. It is not a legal document, but it's there for the next of kin to have access to. And it's a snapshot of basically where everything is. And it's so important for everybody at any age. Uh, Kids starting their jobs, they all have computers, they all have passwords, they all have cell phones. They're investing, they start contributing to their 401k. It's important to even have your kids' information, as well as kids to have parents' information. And it just makes life a lot easier when you share a document like this with your family, or a loved one or a friend, to know where everything is. Because when somebody passes, it's a very hard time, and to get this data, it's very difficult if it's not documented anywhere. So I'm going to take questions. Does anybody have any questions?
I do. I'll put my hand up.
Yeah, go ahead, please.
So where do we go from here? What do we do with this huge document? It's going to be digital and available to be printed also?
Yeah, so I'm sorry, what's your name? I don't know who's answering.
Annette.
Annette. So basically, Annette, I would work with you on this document. I would provide you basically with a list of things that you have to compile in preparation for me to be working with you on this. So again, your bank statements, all your credit cards, all your insurance policies, basically everything I went through on the spreadsheet. And I would sit with you and create this document. We could create it on my computer or your computer. You would have a backup of it on a USB. I would give that to you, as well as I would print it out, and you could put it in a safe place.
I'll be there.
This is one of those things that everybody needs. It's like the healthcare proxy. Wendy, can you stop your share?
Sure, of course.
So it really is one of those things that every single person needs. Wendy is so brilliant at making this so accessible for people. The other thing that's really important in that, for both things, right, is it gives their loved ones peace of mind. I can't imagine how difficult it is when that information is not easily accessible. And again, it's the same thing when we don't make our wishes clear, even if it's for a short bit of incapacity, I should say, then you're leaving your loved ones with sometimes animosity towards each other, because people have different thoughts about what they're supposed to do, just like with trying to find the things. Why can't we find it? They're fraught. You don't want to be making these decisions or making these plans or putting things together when you're in a crisis situation. These are things to be done when we're calm and we have the information, so that it can make it easier for everyone all around. Any other questions?
I'm just putting my contact information in the chat. Mary Elizabeth.
Yes. And so, yes, share this information. Wendy is a gem. She really is. Every time I speak with her, I learn something new. So feel free, we will have this replay available for you all. And the people that didn't show, I know we were expecting about 30 some odd folks. But I know life happens, as we all know. But thank you so much for being here, for participating, and we hope to see you again soon. Oh,
Thanks, Nicole.
Annette wants to say something.
How can we access the replay? Will it be for a limited time? Or
Nope, what we'll do is good question, Annette, thank you. So what we'll do is we will send it out so you can, via email. I'll have your emails from your registration to this. And so you can replay it that way. And it will also remain available on the Care Answered website.
Yes, because I'd like my family to see it.
Yeah, absolutely. That's smart, Annette. Thank you for that.
Yes, it's as Nicole said, all this information is so important to have these documents in place and inform your loved ones of your wishes. And it's so important to share this information that you've accumulated over the years and have them know where things are. It's a very sensitive topic, and it's a tough topic to talk about as well, you know. I've ran into people, you know, husbands and wives where, you know, the husband is in charge of the bills, and he's a little resentful and showing the wife, you know, how to pay the bills, and that shouldn't be the case. Everybody should know how to pay bills and where things are. It's very important to have open lines of communication.
With both of these things, right? It's sometimes very hard for people to speak about, but the reality is it's just the reality, right? So I guess it's because of what I do, you know, asking people if they have a healthcare proxy is just like asking where you live. It should be a conversation like that, because you don't want to be having when somebody's ill, right? That's when it becomes more sensitive, right? They're like, oh no, I have to do all of these things. You just want it to be regular conversation. There is a National Decisions Day, which is the day after, it's the 16th. So it's like the old saying goes, right? There's nothing certain but death and taxes. So they put it right around that day, because it's just a regular conversation to have. You want people to know your wishes. You want people to be able to kind of pick up wherever you left off so that they can do those things for you. Same thing for a power of attorney, right? For this information, for the power of attorney not to have it. It's great that you're power of attorney, but you don't know where anything is. That's not going to be very helpful. Even when you are alive, just not being able to speak for yourself. You need to make sure that the people that you love and trust with this information have it readily.
Absolutely.
All right. Well, thank you. And have a wonderful Memorial Day weekend. And we thank you for all of those loved ones that have served our country. And just enjoy it, everybody. Take care.